So today what we're going to take a look at is lumbar lordosis in dancers and what we can do to help to fix that, as well as, what can we pay attention to in terms of somebody's posture before they might feel pain, and what they can do to protect their spine so that they don't have to end up seeking medical care. So when we take a look at Amelia here, what we want to take a look at is the sagittal plane. So when we take a look at her spine, if we track the normal process of the spine, in a typical spine you would see a little bit of a rotation going forward, a little bit of a curve going back, a little bit of a curve going forward, and then you would see a little bit of a curve coming back. So when we take a look at her spine, and we track it down the middle, she has like a fairly straighter spine. There's not like a ton of curves there, but when you get to that lower spine where the lumbar spine meets the sacrum, you just get like a little bit of a hinge. And so when she's dancing, over the course of time, when she's moving around, that L4, L5 joint gets a lot of activity, meaning there's a lot of stress there. So one of the things that she wants to pay attention to when she's either in training or when she's performing is pay attention to where her pelvis is in position relative to her thoracic spine, her lumbar spine, and her hips. So if she knows how to strengthen her lumbar spine, if she knows how to strengthen her core, and she knows how to strengthen her hips, she can prevent any type of additional stress from developing. So what's common in dancers over the course of time with their rigorous training regimens and all the practices that they do is that they'll get a lot of stress going on at the L4, L5 area. So that can lead to a stress syndrome, and worse, if you don't pay attention to it, it can lead to a stress fracture, which would take you out of the sport or take you out of performances. So it's very critical that you take a look at your spinal alignment when you're a dancer. You take a look at what your training regimens are, and you want to get in an appropriate amount of stretching and strengthening to offset all the training that you do. Because dance is a dynamic sport, you're challenging a lot of the ligaments, a lot of the bones, and a lot of the joints. So over the course of time, it just does a lot of, places a lot of stress on the body. So what we do in rehab is we work on teaching the person about pelvic position, work on lumbar strengthening, work on core strengthening, work on hip strengthening. And if they tend to be more of a dancer that does a lot of jumping and landing, we'll teach jumping and landing mechanics. We'll take a look at core position as you're moving around, if you're on one leg versus the other leg, and that just translates into an overall healthy person. So if we can get Amelia to lie down on her stomach, what we want to do here is take a look at how the muscles are positioned relative to that lumbar spine. So we'll take a look at different length testing procedures. So the first one that's pretty common is just the quad stretch. So we'll try to get her heel to her glute. That's normal there. And on the other side, that's normal. And then what we'll do is we'll take a look at some hip rotation coming in and out. So you can see that she's got a lot of mobility to a point where everything kind of checks out. But when you look at her overall posture, there's just that L4, L5 hinge. And then here we're just going to take a look at your hip extension. So Amelia can move pretty well. So if she were to come into rehab, what her rehab would focus in on would be a lot of lumbar strengthening, core strengthening, and then just positional awareness. And then maybe teaching her different loading procedures so that she doesn't, different load management procedures to know when she needs to take a break. And then what we'll do next is we'll take a look at the lumbar spine. So when we take a look at our lumbar spine, we can see that the muscles are very tense. And this is pretty common in dancers because of their training regimen. So what you want to do is you want to focus in on a lot of stretching routines daily. So in the morning, at night, before and after practice, just to keep your body in optimal health. And then if you turn over to your back, we'll take a look at her spinal alignment and her hip alignment on her back. So we'll take a look at how the malleoli are aligned. We'll take a look at how the knees are aligned. And then we'll take a look at how the pelvis is aligned. So in Amelia's position, you know, she has a little bit of low back pain, but all the joints check out where they have good range of motion, they have good positioning except for that lower lumbar area. So it kind of goes to show you that it's like very important to build up that lumbar and core strength to protect the spine. So what we can do as well is take a look at the core strength. So if we have Amelia bring up both knees and kick the legs out straight and slowly lower the legs down to the ground, you can feel that her back pops up off the table a little bit. So that tells us that the core is a little weak there. So relative to what she wants to do as a dancer, we would just need to do a little bit more core strengthening to better stabilize that spine. So what we can do to stabilize the spine is teach her some abdominal exercises. So in her case, where she's a dancer, she's gonna be pretty good with doing simple basic core strength exercises, so we might want to make it a little bit more challenging for her. So if you turn over to your stomach and then get into a front plank position. So here, what we want to do here is we got like a good solid foundation for that front plank. But now we're going to ask her to lift her left leg up and her right arm up. Yep. And then come back down. And you can see how much she's working. And then you also want to pay attention to how that pelvis is in relation to the lumbar spine. So she's starting to arch it a little bit. So you just want to get her into a little bit of a pelvic tilt backwards. Keep that core nice and tight, and then just do 5 more on each side. So you can see a little bit of struggle with like high-level athletes. You want to like make sure that they're being challenged a little bit, where there's a little bit of like imbalance, so that they're going above what they can normally do and they're going above their potential. You just want to make sure that there's not too much compensation. So here we're just kind of looking at that. We're just looking at that pelvic position. We'll do 2 more. All right, nice job. And then you can go ahead and stand up. And the second one, just to kind of work on single leg strength and single leg and core alignment. So we're just going to do the single leg deadlift. So you're just going to keep your core nice and tight. You're going to tuck your pelvis in so you have like a little bit of a posterior arch. And you're just going to reach down. So you're going to bring your hands to the mid shin and then come back up. There you go, we'll do 5 of those. So if this is like easy for her, which it looks like she's doing it pretty well, we can start to add in some weights. We can add in like a 2-inch foam pad underneath her foot to make the surface that she's standing on a little bit more unbalanced, so that it challenges her a little bit. But those are 2 great exercises that you can do as like a dancer to help to prevent and reduce back pain if you're getting any. And then the other thing is to just pay attention to like training regimens. And then also you can like throw biofreeze, icy hot, and like ice on the back just to help to kind of calm things down.